Welcome to the Medical and Dental channel. This video is part 3 of our cervical screening series. In this video, we'll give you an overview of HPV infections and talk about why HPV vaccination is so important. In part 1 and part 2 of our cervical screening series, you would have learnt that human papillomavirus or HPV is a very common viral infection. There are more than 150 different types of HPV, and each type affects a specific area of the body. Of these 150 or so different types of HPV, 40 of these are sexually transmitted, and they are spread by genital skin-to-skin contact during sexual activity. Approximately 80% of people who are sexually active will have at least one type of genital HPV at some stage in their lives. These HPV types are referred to as low risk or high risk, depending on whether they have the potential to cause cancer.
Infection with low-risk HPV types can cause external genital warts. HPV types 6 and 11 cause approximately 90% of genital warts and are rarely associated with cancer. In terms of the high-risk HPV types, the 14 high-risk HPV types that can cause cervical cancer are types 16, 18, 31, 33, 35, 39, 45, 51, 52, 56, 58, 59, 66 and 68. HPV type 16 and 18 can cause 70% of cervical cancers. High-risk HPV types can also cause other genital cancers and certain oral and throat cancers. Not all high-risk HPV types progress to cancer. In most cases, the immune system clears HPV from the body naturally over time and has no long-lasting effects. High-risk HPV infection that persists can lead to the following cancers: virtually all cervical cancers, over 90% of anal cancers, 65 to 75% of vaginal cancers, 50 to 70% of vulval cancers, 35 to over 60% of penile cancers, and 60 to 70% of oral and throat cancers, including the base of the tongue and the tonsils. How do you treat HPV?
There is currently no treatment for HPV. However, it's important to know whether or not you have one of the high-risk HPV types so that you can receive the appropriate care. As we mentioned, in most cases, the immune system clears HPV from the body naturally over time and has no long-lasting effects. So most people with HPV have no symptoms and will never know that they have it. However, if you do have one of the high-risk HPV types, you're at a higher risk of developing cervical cancer. If high-risk HPV is detected on your next cervical screening test, our next video is one to watch.
For women, once you become sexually active, having regular cervical screening tests is the only way to detect HPV in the cervix. If a persistent HPV infection has caused changes to the cells of your cervix, then your doctor may recommend treatment to remove abnormal cells. It usually takes 10 to 15 years for an HPV infection to develop into cervical cancer. So as long as you make sure that you have your cervical screening tests every 5 years, if you are found to have an HPV infection, it can be managed effectively before it develops into cervical cancer. Unfortunately, there are no screening tests for other genital cancers. If you experience any abnormal symptoms, such as abnormal bleeding, pain or discharge, speak to your doctor for further advice. If you have genital warts caused by HPV, the warts can be treated by your doctor or at a sexual health clinic.
So how do you reduce your risk of HPV infection?
If you have never been sexually active, then you are unlikely to become infected by one of the genital HPV types. Remember, HPV is spread through skin-to-skin contact. So when we talk about sexual activity, that includes vaginal, oral, anal, and any type of genital skin-to-skin contact, not just penetrative intercourse. If you are sexually active, you can reduce your risk of HPV infection by using condoms. Condoms may not fully protect you against getting HPV though, because HPV can infect areas not covered by a condom. And remember, you can pass on HPV even if there are no signs that you or your partner has HPV. The more sexual partners you have, or the more sexual partners your partner has, the higher the chance that you will become infected with one of the high-risk HPV types. Being in a mutually monogamous relationship can therefore reduce the risk of you becoming infected by HPV.
Vaccination against HPV can help to reduce the risk of genital HPV infection. In Australia, there are currently 2 HPV vaccines available, and you'll need either 2 or 3 doses depending on your age at the time of your first HPV vaccination.
The Cervical vaccine is registered for use in females from 10 years old up to 46 years old. The vaccine protects against 2 high-risk HPV types, HPV 16 and HPV 18. The other HPV vaccine available in Australia is called Gardasil 9. And this is a vaccine that is given free as part of a government-funded school vaccination program for 12 and 13-year-old girls and boys. Gardasil 9 is registered for use in females 9 years old up to 46 years old and males aged 9 years old up to 27 years old. The Gardasil 9 vaccine contains HPV 6 and 11 that cause 90% of genital warts. It also protects against high-risk HPV type 16 and 18 that cause 70% of cervical cancers. It also protects against high-risk HPV 31, 33, 45, 52 and 58. So as you've probably worked out, the Gardasil 9 vaccine contains 7 out of 14 high-risk HPV types. It therefore does not provide 100% protection against all the high-risk HPV types. However, it can prevent the majority of cases of cervical cancer and genital warts, particularly if it is given before a person becomes sexually active.
In females aged 16 to 26 years who are HPV naive, meaning they did not currently or previously have HPV, vaccination against HPV was shown to provide over 95% protection against genital warts, cervical cancer, vulval cancer, vaginal cancer, and anal cancer. In males aged 16 to 26 years who were also HPV naive, vaccination against HPV was found to be 84 to 100% protective against genital warts as well as persistent anal and genital infection that can cause anal and penile cancers. There is new evidence though which shows that the Gardasil 9 vaccine is still 66% effective even if you have been sexually active in the past and even if you have had previous cervical screening tests that have shown cervical cell changes. If you're an adult or have missed out on the vaccination through the school system, you can speak to your doctor about whether you should be vaccinated. The vaccine costs around $150 per injection and you will need 3 injections over 6 months.
HPV vaccination is generally well tolerated. The most common side effects of the vaccine include mild pain and redness at the injection site. Allergic reactions from HPV vaccinations are rare. Remember that whether or not you have been vaccinated against HPV, all women aged 25 years and over who have ever been sexually active should have regular cervical screening tests. The current HPV vaccine does not protect against all the high-risk HPV types. It protects only against 7 of the 14 high-risk HPV types, and so there is still a risk of HPV infection and hence of genital cancer even if you have been vaccinated.
Also, it's important to remember that HPV vaccination does not provide any protection against other sexually transmitted infections. If you are sexually active, the only way to help protect yourself from STIs is to use condoms. To find out more about HPV, cervical cancer and cervical screening tests, have a look at our previous videos. If you would like us to discuss any specific topics, don't forget to leave a comment down below.
Thank you so much for watching. We hope you enjoyed this video and learnt something new.
If you liked this video, don't forget to like and subscribe and turn on the notification bell to stay up to date with our uploads. And remember, a healthy mind and a healthy body lead to a healthy and happy life. Thanks again for watching.
See you next time.
You were my best friend. Didn't care about the rules, good on the weekend.